Welcome back to Punchline. Well, tonight we bring back our segment COVID Watch as a surge in cases across the country worries health workers who are themselves succumbing to the disease at a concerning rate. There is mounting frustration in the medical community that cries to prioritize their safety have fallen on deaf ears, with more than 4 losing their lives to COVID-19 in 24 hours. The Doctors Union convened a special National Advisory Council meeting today and issued a 21-day strike notice claiming that the Health Cabinet Secretary, Mutahi Kagwe, has failed the President and failed Kenyans. KMPDU Secretary General Dr. Chibanzi Mwachonda now joins us here in studio. And good evening to you, Daktari, and thank you for joining us. And of course, our condolences to the families of those fallen heroes. But Doctor, I want to begin by playing for you this clip by a medical resident which gained traction online. Watch.
We are out here on the front line trying to fight this pandemic, yet we have no support. You know, doctors in the county government still have issues getting PPEs. PPEs are a problem. These are the things that protect us from contracting COVID-19. And yet they're still expected to work. Yet you're threatened if you don't go to work, if you don't report to work and you don't have the equipment. But here's the thing. You're forcing us to work, forcing us to treat Kenyans. And when we contract this disease, NHIF is not covering. We don't have comprehensive insurance coverage. We have no package whatsoever for our families when we depart. Because the reality of the matter is, right now, doctors are endangered species. Whenever doctors speak, it's on deaf ears. The people themselves always have this issue with doctors, saying that we're greedy, it's our calling, it's our profession. Listen, I didn't sign up to go to willingly die. I did not. I signed up to treat sick people.
Like I said, a clip that has gone viral on Instagram of medical practitioners. So once again, condolences to the families of our fallen doctors, the health workers who have passed on in their line of duty since the start of this epidemic. You convened a special National Advisory Council meeting today of the union, after which a strike notice was issued. What necessitated this move?
Thank you, Anne. You know, I listened to Dr. Rain, who happens to be a very good friend of mine, and it's touching, and I know so many doctors actually relate to that. This advisory council meeting was not the first this year. We've had 4 other advisory councils, but when the union and the leadership of the union sees that a crisis is getting out of hand, then there is all reason to convene the advisory council to deliberate on the matter and get to understand the background. And that is why it was convened. And the background is that there have been several issues pending. COVID-19 pandemic has been in this country for 8 months. But if you're looking, I'm the Secretary General of the union. I get all the issues that appertain members on my desk. And my role is simple. This is labor relations. The Constitution knows that we have unions and recognizes unions. And the unions are the link between the employee and the employer. Right. And if those on the employer's side feel and actually show contempt and disregard to the unions and feel that unions should not have discussions with them, then there's a problem. And that problem is in the management side. And I'll tell you this, and I'll say it, that the CS and PS are not the first ones in that ministry. KMPDU has been in existence for 10 years now, and we have engaged CSs and PSs before, and we have come up with solutions on matters appertaining our members. But when you decide that you are not going to engage, then you're creating a situation of what we've seen. And
yes, let me just question you on that quickly, just before we go to break, and of course we'll come back with you. But you said they've decided not to engage. Be specific, what does that mean? The union has reached out to them, sought meetings, and what is their response? None?
So we've reached out. Since the beginning of the pandemic, we've reached out several times, meetings, requesting for meetings, on a number of issues. And you know, when the pandemic was declared, we were very much ready and willing to engage. And we even said we're not going to engage in any industrial action. So the issues that are pending, the issues that are coming out, need to be addressed. And that's what the union's role is. So when those issues are not addressed, or in that channel of engagement, as per the tripartite agreement of which the ILO determines how labor relations are, is broken on one side, then you're creating such a scenario.
So to be clear, you're not, are you saying that they have refused to meet you, or you're saying they've refused to engage you in good faith to resolve those issues?
They have declined to meet the union, not just
completely.
me,
Okay.
not just me as the
right,
individual,
of course, the
union, yeah.
Right. Right, okay. We'll leave it at that. We're coming back after the break to get into the specifics of what doctors want and the true picture of COVID-19 in the country, how hospitals are coping, and whether schools should at all be reopened. We're speaking after the break. Stay with us.